All right. Oh, still don't have a voice. Hi, everyone. Putting Instagram, then I'm all ready for you guys. This is Dr. Isabelle Amigues, a rheumatologist. And today we're going to talk about osteoarthritis. Okay, that's it. Live is on for Instagram. So such a pleasure to see everyone. And well, I don't see anyone, of course, but I'm sure I will. And yeah, thank you for being here. And today we're going to talk about osteoarthritis. And the reason I'm sharing this and I'm doing a post on a live on this is that it's come to my attention, and I'm really sorry that I never realized this. Is that the osteoarthritis is actually the most common cause of arthritis, yet we don't talk about it. And so rheumatologists do not talk about it. And I'm going to explain why we don't talk about it. But I think the most important thing that I realize is that most of the patients don't understand what it is. And so what happened, and so I'm going to tell you the story, which is I had a patient recently that came to me and was almost in tears because she was, pretty young. And she thought, oh my goodness, I was told that I have osteoarthritis. I was dismissed by the previous rheumatologist. And I'm scared because it seems to be progressing. And so then, basically the whole time of our visit was, well, to make sure that it is indeed osteoarthritis. But the second thing was, what is osteoarthritis, right? And how do we make that diagnosis? And what is it really? Like, what is the most common form of joint pain, of arthritis? So first thing, osteo, that means bone. Arthritis is joint pain, right? Like, so it's joint pain, and that involves the bone. So, when we are thinking in rheumatology, sorry, my hair is bothering me. So when we are thinking in rheumatology, we always come from, okay, first thing, there's joint pain. And then once there is joint pain, then you're thinking, okay, is this joint pain an inflammatory type of joint pain, or is this joint pain a non-inflammatory or a mechanical joint pain? The difference between the two are going to help us understand if this is osteoarthritis or inflammatory arthritis. And so you hear me talk a lot about rheumatoid arthritis, lupus, spondyloarthropathy, ankylosing spondylitis, those, or gout or pseudogout. Those are inflammatory arthritis. They are worse in the morning. They are associated with morning stiffness. They are associated with swelling of the joint, that's soft tissue swelling, right? On the joint pain that's mechanical, or that's usually linked to osteoarthritis. And usually the pain is worse at the end of the day. It's worse when you're using the joint, and it's not associated with morning stiffness, okay? So once we have made that thing, and this is what's happening for patients, is that usually they'll go to the rheumatologist, and the rheumatologist will be like, okay, you don't have an inflammatory arthritis, this is osteoarthritis. And they literally are just like, okay, bye. And it comes to my attention that we don't take the time to explain what it is, because for us rheumatologists, it's obvious, and it's like, okay, this is not dangerous. You don't need me, right? The problem is that in the other sense, is like you're actually seeing your joint deforming, you're having pain, and you don't know what's going on. So let's explain what osteoarthritis is. So the number one thing is that it's the most common cause of joint pain. So our grandparents have it, everyone has it, right? Like hopefully I'm going to wish that you all have it, because that will mean that you're growing and that you're, getting to an older age. And that's a good thing, right? Second thing is that it's not dangerous. When you have rheumatoid arthritis, if you don't take care of it, there is inflammation going on. That can be a problem, not just for the joint. It can actually cause issues of your heart, of your vessel, and of your lungs, of your system in general, right? when you have osteoarthritis, we don't think that this causes any harm to your body in general, other than the joint. The second thing is that, yes, it can be destructive, and there are different types of osteoarthritis, but it's not destructive the way that rheumatoid arthritis or ankylosing spondylitis or psoriatic arthritis or gout can be. And so then you're really dealing with just joint pain and then a little bit of joint function, but not to the degree of those other inflammatory arthritis. The third thing, this is probably why rheumatologists don't talk to you guys about this, right? Is that we don't really have medications that work just yet. Because it is mechanical, we're going to we're not lowering the immune system, because that wouldn't work. What we're doing is that we are just helping with pain. When that is the case, you have to always think that we probably don't know much about it. And so hopefully with time, we'll learn more about what osteoarthritis, what we can do to prevent osteoarthritis, what we can do to prevent worsening of osteoarthritis. But we're not there yet. I do think that in the next 20 years, we'll have treatments for osteoarthritis. We'll know more about it. There's more and more research. It's a huge market share for pharmaceutical companies. And so there's a lot of money to be made. And when there's a lot of money to be made, usually pharmaceutical companies look at this and are putting some energy and some money into this, which is great. We need treatments, right? Now, what is it? Okay, so this is actually kind of an important thing to understand. Osteoarthritis is the end point of any arthritis to your joints. So what I mean by that is that you can absolutely have an inflammatory arthritis in the beginning, and that can lead to osteoarthritis. So you can have osteoarthritis and inflammatory arthritis together, okay? So some people are like, yeah, I have osteoarthritis. Now, what does that mean when I have rheumatoid arthritis? That means you've had rheumatoid arthritis that led to osteoarthritis. We can deal with rheumatoid arthritis. We can deal with inflammation. Once the loss of bone has been made, you cannot rebuild it. So I'm not a good drawer, so I'm not going to do that. But I want you guys to imagine what a joint is. So you have two bones, and at the top of the bone, there is the cartilage. The cartilage does not have nerve ending, which is actually super helpful because you don't want to have pain when you're moving those joints. So when you're running, for example, you're not supposed to have pain because the cartilage is an incredibly powerful tissue that can hold a lot of the force that's pushed on it, right? And so it's both, it's both super, super strong, but also cushy. And what it does is that it's preventing the bone that's underlying to have any sort of damage, because you're taking all of the strength when you're walking or using your joint to the cartilage first. The other thing is that so then what happens with osteoarthritis is that you're losing some of the cartilage. And the first sign on X-ray is that you have a decrease of space of the bone. So you can't actually see the cartilage on X-ray. What you're seeing is the bone. And as you're seeing that the space has reduced, that tells you that there is a beginning of osteoarthritis, because there's the beginning of loss of cartilage, which you're seeing as a secondary loss of space in the bone, okay? So that's important. Once you lose that cartilage, the body is basically doing what it can to regenerate cartilage. Somehow, though, in osteoarthritis, our body is not able to make more cartilage. And so it's the bone reaction to create some sort of bone. So it's you have to see it as okay, well, and we don't know all exactly what happens, right? But we think that that's one of the things that's happening, is that basically you're losing the cartilage, and the bone that's underlying is like, okay, I've lost cartilage. Let me make what I can make to prevent that and to help. So it's really your body's way of helping your cartilage is trying to help your joint by making bone. And the way it makes bone is not efficient. It doesn't work basically, because it makes those bones spur. And so you can see that you have some evidence of nods on your joint. So if you're taking the hands, and so for example, I have osteoarthritis personally because I rock climb, and sometimes I don't rock climb well, especially at the beginning. And so I was putting a lot of tension on my joint instead of putting it on my muscle. To be honest, I just didn't know how to do it, right? And so I have a little bit of osteoarthritis here on my fingers. You can see it, right? And so you're seeing some nodes at the top. It's usually the third finger for climbers, sometimes the second. And if you have had grandmother, very often they have that. Like if they are older grandmother, my grandma had that. Like she had nodes at the tip of her joints, at the last phalanx of the fingers, right? And then you can also have it on the other phalanx, not phalanx, but like the other joint of your fingers. So the last one and the second one, that can happen. Okay. And then you can have it in every single joint. You can have it in the back, you can have it in the knees, you can have it in the hips, etc. And the way, like, so you're gonna see those bones spur, and they can do nods, and they can cause pain, right? So like every time it makes those bones spur, you can have pain. And then the other thing that it does is that it's going to create some sort of erosion of the bone, because once you lose that cartilage, after that, the next step is the bone, right? You've lost the cushy feeling, you've lost that cushion. So then it starts eroding into the bone. And that is what causes what we say is osteoarthritis, okay? So once you have this osteoarthritis, then you can have erosion. So we said thinning, erosion, and then you can have subchondrial cyst. And that's one of the vision that we have when we're looking at the x-rays. We can see that there are some subchondrial cysts, okay? So just to summarize, when you have osteoarthritis, you get some pain that's mechanical, worse at the end of the day, worse with movement, and that's improved with rest, and there is no morning stiffness. Sometimes you can have up to 30 minutes of morning stiffness, but usually you should not have morning stiffness, okay? And then on x-rays, you're going to see thinning of the space between the bone. You can see subchondrial cyst, and you can see bone spur, okay? So once you have that, that's osteoarthritis. Now, we don't really know how well. So there's a couple of things. You can prevent osteoarthritis by helping not doing too much on your joint. So what I mean by that is that you can help your muscle take over instead of the joint. So for example, if you're walking and you're doing a 14er, like a lot of people do in Colorado, or just hiking, you can use poles, because that's going to be super helpful. And then the other thing you can do is that you can actually engage the muscle of your knees. And so that's the quadriceps, the hamstring. And when you're going down, so that's actually, you can actually just pay attention to what you do when you're going down on a hiking. Pay attention, and instead of just throwing your legs, just be like, okay, am I taking my muscle? Am I engaging the muscle so that I'm going down with like the use of my muscle? And when you do that, you start actually exercising your muscle and using your muscle instead of using just the cartilage, right? You can do the same thing when you're running. If you're a runner, just be like, okay, am I engaging properly my muscle? It takes a little bit of time, because it's not like, we learn how to walk as kids, we learn how to run as kids. And so we don't actually think of all of the things that we have to do to get there. But now that we are adult, we are analytic and we can think of all of that, and we can just rework our brain to learn how to do this, right? And so that's something that can be done. So, right, so use your muscle, help. So if you have knee pain, use some pulls. Now, in terms of the reason very often why we do develop osteoarthritis is that we do repetitive use. So, for example, if you're a rock climber, you can learn how to prevent that by helping strengthening your muscle of the forearms. That's going to help with your hands. And then you can also try to avoid repetitive movement. And the number one repetitive movement that everyone does right now is related to the phone. And so that is something that you may want to consider, is that instead of using your thumb, maybe like do voice to text. I have a problem with that because Siri doesn't recognize my French accent. But if you can, I would highly recommend that. If I could, I would absolutely do that instead of using my thumb, because at the end, what it does is that it does create osteoarthritis of your thumb. So yeah, and then in terms of treatment, we have a couple of things that you can do. So pain relief, of course, but then there's turmeric. There's a small study that showed that turmeric can help with the pain of osteoarthritis. That's something to consider. All right, but in general, I would say if you do have osteoarthritis, there is really no risk for your well-being overall. And so I want to really reassure you, this is not inflammatory arthritis. Okay, so this is not inflammatory arthritis. And we can, like, the one thing that you want to make sure is that it is indeed osteoarthritis, that there is no inflammatory component. And so I'm just going to leave you with this. If you have yes to any of those questions, go and see a rheumatologist to make sure that it's not inflammatory. If you have pain that's worse in the morning, if you have pain that's improved with exercise, and if you have morning stiffness, then I recommend you see a rheumatologist, because it may not be osteoarthritis, okay? But until then, I think that's it for today. Lots of people have joined in. I'm so sorry I didn't see you. Elf Coach, thank you for joining. Heather, always a pleasure to see you. Dr. Una, hi. Blue Sagero, Angie, and then Teresa Amy and Angela, thank you so much for the words. And if you are watching this on replay, share #replay, share this with people whom you think are afraid of osteoarthritis so they understand how it works, okay? And then I'll see you next week. Bye-bye, everyone.